Dillon and I'll be giving a presentation about depression. Think of 10 people you've spoken to today. Family members, loved ones, co-workers. Were they happy? And would you have been able to tell if they were not? Statistically speaking, one of them was depressed. According to the United States Center for Disease Control, 1 out of 10 Americans suffers from clinical depression. Now, everybody has days when they feel like they just can't win no matter what they do, and that everything that could have possibly gone wrong did in fact go wrong. But imagine if that was every day for you. That's how people with depression feel. That's how 1 out of every 10 Americans feels every single day of their lives. In order to help treat these patients, doctors in America prescribe drugs called antidepressants. But people often forget about and overlook the alternative method of seeking professional help from a therapist trained to get people through this exact sort of problem. Today I'm going to tell you why the latter is a much better option and a safer option than taking drugs. Because antidepressants can be addictive, they don't actually fix depression. And in some cases, they may in fact make it worse. Medically speaking, addiction is a simple concept. And antidepressants can be said to be addictive because of the simple fact that when patients stop taking them, they experience withdrawal symptoms. Take, for example, the case of Jamie Tierney, a young lady who started taking an SNRI called Effexor when she was 14 years old. 2 years later, when she stopped taking Effexor, she experienced vomiting, drowsiness, electrical tingles throughout her body, and thoughts of suicide, all of which are telltale signs for withdrawal. And according to psychiatrist Dr. Joseph Glenmullen, the anguish caused by these withdrawal symptoms are enough to send a person spiraling right back into depression. Now let me offer you the Merriam-Webster dictionary definition of medicine. It is a substance or preparation used in the curing of disease. So if antidepressants are medicines, shouldn't they cure depression? Well, according to an FDA study conducted in 2002, 80% of the control group given a placebo pill instead of antidepressants reported having more positive results than the group given actual antidepressants. Now, the way depression is caused is by a chemical imbalance of a neurotransmitter in your head that is responsible for sadness. And when you take an antidepressant, these molecules are still produced. Their function is just inhibited. And since they can't carry out their function, these inhibited molecules just build up one after the other, kind of like water behind a dam. And when the dosage wears off, it's like the dam breaking. And all of the chemicals are released all at once, sending the patient plummeting into a hard-hitting, profound bout of depression. And this leads the patient to take higher doses of medicine, which leads to even harder-hitting depression after the dose wears off. And this cycle continues for years, for decades, for some patients. That can be called an addiction in and of itself, even without the withdrawal symptoms. And people may argue that therapy takes a lot of time out of your life, and that taking antidepressants is an easy, quick fix to the problem. And that could be said if the pills actually fix anything. But the fact of the matter is that therapy is a whole lot cheaper than years of refilling prescriptions. And according to Psychology Today magazine, it's statistically a lot more effective at treating depression. In closing, I want to leave you encouraging you to look around at your family and your loved ones. And if any of them are suffering from depression, push them to go past the temptation of the quick and easy route of the pill, and to instead seek professional help from therapists trained to do just that, to help you past these problems. After all, don't we want to get past our problems? Instead of letting them pile up one after the other until eventually, well, see for yourself.